Okay. My boss is giving me the high sign here. It's time to start. It's with great pleasure that I introduce tonight Dr. Abdul Nassar Kaadan. Dr. Kaadan has been an orthopedic surgeon since 1986, and in 1993 he received his PhD in the history of medicine from the High Institute for the History of Arabic Science at Aleppo University. He was chairman and professor in the History of Medicine department at Aleppo, where he also taught history of medicine and medical ethics. He has corrected many misunderstandings and fallacies regarding the history of medicine, especially those relating to the achievements and contributions of Arab and Muslim physicians over time. He's the founder and president of the International Society for the History of Islamic Medicine and is the chief editor of its journal. That journal is also published in English. He's participated in more than 110 congresses, and he's published over 65 papers and 8 books. In 2012, Dr. Kaadan was nominated for the Nobel Prize in Literature, and it's our great pleasure to have him here with us tonight. Thank you, Dr. Kaadan.
Thank you. Thank you. Actually, first of all, I would like to present my thanks to the organizer of this conference. And secondly, actually, it is my pleasure and honor to be here for the second time, actually, to present this presentation. In this time, actually, I have 2 presentations. Everyone, it's about 30 minutes. The first one, as you can see, it will be about Islamic medicine contribution to the world. And firstly, when we begin by Islamic medicine, many people actually used to ask me what we mean by Islamic medicine. What does it mean, Islamic medicine? And you know that this is Islamic medicine, or sometimes called Arabic medicine. And very briefly, Islamic medicine, it means the medicine which widespread during what we called it Islamic Golden Age, during medieval times, which lasted for about 600 years, 6 centuries. It began from the 8th century until 13th century, where Baghdad, it was invaded and completely destroyed by the Mongol invasion. And this is, at the end, we called it Islamic Golden Age. Even some scholars of history of science, they believe that it continued after Baghdad. It continued in Damascus, in Cairo, in Cordova, in Spain, until 16th century. So anyway, this is what we called it Islamic medicine. And sometimes, as I told you, it's called Arabic medicine, because all of these medicine at that time, it was written in Arabic. Not only medicine, all branches of sciences at that time, Arabic language, it was the language of science exactly such as nowadays English language, which is nowadays English language. You know that it's the language of science worldwide. If you want to go to German, for example, to attend international conference, they will say that the official congress of the language of the congress, it is English. In Russia, the same thing. In all over the world. At that time, for 600 years, Arabic language, it was the language of sciences, including medicine. So, which lasted until the age of enlightenment in Europe. And according to many of scholars who are interested, specialized in history of science, they believe that all of these Arabic sciences were translated into Latin and introduced to Europe by this Latin translation of Arabic sciences. And these sciences represent an important base on which all European sciences build on. And it was the beginning of Enlightenment age in Europe. And without introducing such sciences, many of scholars believe that actually European Renaissance could be delayed many centuries. So this is about, and this is the area where Islamic medicine widespread. Actually, it is from the border of India until, you know, that all of Middle East, including north of Africa, until Europe, the border of France, including Spain. Because as you know, at that time, Spain, it was ruled by Muslim scholars, and they built an important civilization there. Mainly the city of Cordoba, which considered the most civilized city worldwide during the 10th century. So if you look to Islamic medicine, actually, maybe 50, 100 years ago, there was little known about achievement of Islamic medicine. And this is just an example. This textbook is very important. It's considered the Bible of textbook of history of medicine in Britain. It was published from Oxford, and you can imagine that this textbook consists of more than 600 pages. They devoted, how much do you think that they devoted, how many pages for talking about Islamic medicine, which lasted at least 6 centuries, as we mentioned? Actually, they devoted only 3 pages for talking about Islamic medicine. And at the same time, you can imagine they talk about the achievement of Leonardo da Vinci in medicine in 5 pages. So it means that they talk less than they talk about Leonardo da Vinci achievement in the field of anatomy, because he left some picture related to human anatomy. Anyway, when I was medical student, I recognized to how much there is ignorance about the achievement of Islamic medicine. Then I decided to make something to introduce Islamic medicine to the world. And I contributed in establishing this society, which is International Society for History of Islamic Medicine. We established in Doha. You know, Doha, one of the richest countries worldwide. And they sponsored the foundation of this society. And until now, we actually held about 7 international congresses, and this is our journal, which is published, the Journal of International Society for History of Islamic Medicine, which published in English. So far, we published 36 issues of this journal, which is loaded on the site itself. We have a site, and a few years ago, my colleague in the society, they gave me the honor to become a president, and nowadays I'm the president of this actually society and the chief editor of its journal. And actually, after that, we have got many benefits from that. This is one of our first benefits. To find such kind of book, which was published from an important scholars, American scholars, his name is Plinio Prioreschi. He is Italian originally, but he lived here in America. This man, he published the most important book related of history of medicine worldwide. This book consists of 6 volumes, and he devoted the 4th volume, as you can see, talking about Byzantine and Islamic medicine. And 2/3 of this volume, it was devoted for Islamic medicine. It's about 300 pages. So you can imagine, before it was only 3 pages, now we are in front of 300 pages talking about Islamic medicine from American scholars. I met him personally in one of these conferences related to history of Islamic medicine. It was 20 years ago in Florida, in Orlando, Florida. So in addition to that, we noticed that we have many of books actually edited related to Islamic medicine. This one of them belong to Oxford itself. It's published by Oxford and by a very important scholar specialized in history of Islamic medicine. Her name is Emily Savage Smith. She is a British woman, and she is a British scholar, mostly in the field of history of Islamic medicine. This is another book which is actually devoted for history of Islamic medicine. And this one also talk about the medieval Islamic hospital, because it is believed that Muslim scholars were the first, they established hospitals actually. And at that time, as I told you, Cordoba was very civilized, and it contains about 100 hospitals during the 10th century in Europe. Actually, let's begin talk about the achievement of Muslim scholars and how they affected European medicine. This is the first man, this man who lived about 1,100 years ago. His name is Hunayn ibn Ishaq. Hunayn ibn Ishaq, as you can see here, he was a Christian man, and he worked in what we called it the Wisdom House of Baghdad. The Caliphate at that time, about 1,100 years ago, he founded what we called it the Wisdom House in Baghdad. This Wisdom House, it was the core of Islamic Golden Age, where all branches of sciences translated in this house. All Old Indian, Chinese, Greek, actually books, it was translated. And from this Wisdom House, it was many, many books edited in Arabic, which belong to different branches of science. This man, he was the chairman of the translators team. And as I told you, he lived about 1,100 years ago. And his name is Hunayn ibn Ishaq. Ibn in Arabic, it is very important to know that it means son, or in English, Mac. You know, we have McDonald's now. I'm surprised that many Americans, they never know what does it mean. McDonald's. McDonald's means Donald the son. Mac means son. So McDonald means Donald the son. It's just like here, Ibn, the majority of names, Arabic name called like Ibn Ishaq. So Mac Ishaq, it means if you want to translate it into English. So this man, as I told you, he was very important man because he worked in the translation of many, many medical books. He transferred all Greek heritage, medical heritage, Hippocrates, Galen, the majority of their books, he was translated by this man. And not only with this, he put this very important book about the eye. And this book is considered the first Arabic book related to ophthalmology, which is isolated book related to ophthalmology. It was edited by this man, and you can see that he wrote on medical subject, particularly on a human eye. And this book of that man, he actually called the 10 Treatises on the Eye, and was influential in the West until the 17th century. So you can imagine that for about more than 500 years, this book was very important in the field of ophthalmology. And because of the importance of this book, it was translated into English early during the 30s of last century, which was translated by Max Meyerhoff. He's very important German ophthalmologist and historian of medicine. When he recognized to how much extent this book is very important, he translated it during the 30s of last century, translated it into English. And as I told you, Max Meyerhoff is considered one of the most important ophthalmologists worldwide during the 20th century. And this is actually also an American translator. Just recently, 2 years ago, in 2016, he translated Hunayn ibn Ishaq on his Galen translations. He translated all of the works of Hunayn, which represented translations of Galen into Arabic. And then this man translated, his name is John Lamoroux. He's American. And 2 years ago, he translated all of the work of Hunayn, which is related to the Galen works. And he brought the translation, Arabic and English translation of this book. According to Britannic Encyclopedia Britannica, they said, when they talk about this man, Hunayn ibn Ishaq, they said that this man, especially important, are his translation of Galen. Most of the original Greek manuscript of which are lost. Without that translation of this man from Greek into Arabic, we don't have the original books related to Greek medicine. And European people, they will never know about Greek medicine except from the translation into Arabic and from Arabic into Latin languages. So this represents an important man actually in the field of translation of medicine. Let's now go to another issue. This man also is very important scholars. He's very, very important physician. His name is in Arabic Al-Razi, in English Rezios. This man, he was born in Iran, in Al-Rai city near to Tehran at that time, and he moved to Iraq because, as I told you, in Baghdad there was the Wisdom House of Baghdad, which attracts many scholars from all over the world at that time to work in this center. And actually he left to Baghdad and he worked there. And this man, he was very important for many achievements. For the first time in history of medicine, he differentiated between what we called it smallpox and measles. When I was medical student, it was about more than 30 years ago, I remember that I read in Harrison, I think maybe all of you know Harrison textbook of internal medicine, which is very famous worldwide. When I was in Syria, I used to study this book. And they mentioned when I reached to smallpox, they said, Rezios, a Persian physician, is considered the first time in history of medicine who differentiated between the two diseases. Because before his time, it was believed that it is the same disease. And you know that it is different, greatly different. Smallpox, because about 50% of the people who had smallpox, they will die. And fortunately, nowadays, it's completely eradicated. Not now, it's maybe 50 years ago. While measles is very benign disease, no problem, and many people, they may get it without any problems. So this man, it was the first time in history of medicine, he actually talked about that. And this book 300 years ago, this book in Arabic, and then this is a translation into Latin. It was 300 years translated into Latin language. And not only of this, because it is very important, this book just recently, actually in Britain, it was translated into English because the importance of this book is still important. You know that some people may believe why it is important. Nowadays, everything is changed. Suppose that you want to talk about papers. Nowadays, you will publish a paper in American journal, something like that. In all papers, they begin firstly by talking about historical background. Suppose you want to talk about something related to measles. Before you will begin to talk about that, you will begin by talking about historical background. It means that you want to review in history which time we know measles for many thousand years or 100 years or something like that. These kind of books, it's extremely helpful. And I think many of people, they may get mistakes if not going back to this book to know, for example, about 1,000 years ago, it was differentiated between the two diseases, smallpox and measles. So this is one of the importance of this book because it gives us an idea about historical background of many diseases which still nowadays talking about. So this is just recent translation of the book itself. Again, it is a treatise on smallpox and measles, which is written by Rezios. This is English translation, which is just recently bought. Not only of that regarding Rezios. Rezios is very important man because he published this book. This is considered nowadays, it was edited 1,100 years ago. Until today, the largest medical textbook written in Arabic. You can imagine. It contains all our medical information since prehistoric man until the time of Rezios, including Greece medicine, Indian medicine, Chinese medicine, old, of course, Chinese, old Indian, old Mesopotamian, old Egyptian medicine. Everything is written in this book. It's represent a document, medical document, which give us an idea about how it was practiced medicine about 1,000 years ago. And not only of that, this is, fortunately, I'm so happy to know that a complete copy, which is manuscript, still handwritten, which belonged to about 1,000 years ago. this manuscript. It is kept where? In NLM. Who knows what does mean NLM? Exactly. It's National Library of Medicine in Maryland, which is considered the largest medical library, not only in America, worldwide. I am so happy when I know that this manuscript kept there, because it's kept according very, very strict conditions to keep it not to be destroyed. Disinfected, number one, humidity, special humidity, and everything according how we can actually keep manuscripts. And this one considered the oldest manuscript kept in National Library of Medicine. It belonged to 1,000 years ago. It was written. So this is very important manuscript. And then this book, which is called Al-Hawi Book of Rhezios, it was again translated by a Jewish man. His name is Faraj bin Salim into Latin in 1279. And European people, they knew all of medical knowledge at that time via translation of this book into Latin. And without such translation, there will be something lacking in our knowledge, medical knowledge, which belong to old times, actually. And this is the first page of the translation of this book into Latin, which was done in the 13th century. Actually, if you have to this book, it is mentioned that it is one of the relying book in the library or in the Paris Library of Medicine, actually during the time of 14th century. And this book, it was very important one after it was translated into Latin. Actually, we have many things to talk about this book, but just I would like to mention about this issue, which is, we called it now, I think vast majority of you know what we mean by Baker cyst, which is just behind the patella. We have a kind of cyst. Mostly we can see it during osteoarthritis of the knee joint, and it is attributed to Baker. William Baker, who was English surgeon, he described it in 1877. But if you go to this book of Al-Hawi of Rhezios, he described it in more details than it was described by Baker. So he described it about 900 years before Baker. And we have many things about that. But unfortunately, many people, they never know that it was actually many of Muslim scholars, they talk about many issues, and nowadays, which is attributed as the president of the society, when he introduced me, actually I used to correct many fallacies related to this issue. This is one of these issues. We called it Baker cyst, but actually it described many times or many years before Baker. Anyway, so this is about Baker cyst, you know what we mean by Baker cyst. And the next one, I would like to talk about this man, Al-Hazan. His name is Al-Hasan ibn Al-Haytham. You know the Ibn. Always we repeat Ibn, which is Mac in English. Don't forget that. Ibn in Islamic civilization called Mac, or the son. So this man, Ibn Al-Haytham, he was very important. And according to many historians of sciences, they believe that he is the father of experimental science and scientific methodology. He began it about 1,000 years ago. He was born in Al-Basra. You know where is Al-Basra city? It is in Iraq. It's south of Baghdad. Al-Basra city. He was born there, and then actually he left to Cairo, and he worked there. And this man, he was very important. Actually, he was a kind of polymath. You know what we mean by polymath? Encyclopedic man. And actually, he took many different branches of sciences. But the most important thing, when he talked about in the field of optics, for the first time in history, he corrected the theory of vision, which is written by Greek scientists. They believe that when we will see rays were emitted from the eye to an object and back again. He said this is wrong. And he approved that not our eyes, the object itself. It will emit a ray to our eyes, and our eyes enable us to see this object. So not the beginning is our eyes. The beginning is from the object. And it's still, this theory is valid until nowadays. He is considered the first one. He talked about what we called it the theory of vision in human being, and corrected what was wrong written by the Greek philosopher. And then he talked about, maybe the first time in history, about what we called it optic chiasma. Many people, they believe that all of our anatomy information is just belong to 100 years ago. And before 100 or 200 years ago, it was nothing. Or before maybe Renaissance, European Renaissance. But you can imagine this man, about more than 1,000 years ago, he talked about what we called it optic chiasma, and he is considered the first man in the history. And again, his book on vision, it was translated into Latin. And European scholars, they actually knew this branch of science via the translation of his book into Latin. Now let's go to another one. I think many of you, they know about him. His name is Avicenna. Avicenna, he is a great philosopher and great physician. And he was very important man. He was born in what we call it nowadays Uzbekistan, Republic of Uzbekistan, which at that time belonged to Islamic countries. And he belonged to Islamic civilization as well, or Islamic Golden Age. And he worked there. But the most important thing, this is again the book I mentioned, which is edited by Oxford, which is considered the Bible of history of medicine. They talk about this man, about his book, and they said the Kaadan book, the main textbook of medicine, both among the Arabic-speaking people and the Latin West, until 17th century. I think that this book, how he said that, and not to explain or devote many pages for talking about this book. And he recognized that this book, it was at least 500 years in teaching in European countries. So what is the content of this book? So unfortunately, they never mentioned that, this book, in this book. But this is the Latin translation of his book, which still in teaching until the 17th century in Europe. It's according to many encyclopedias. And this is, again, the Latin translation of the book. And this is the hardcover. Fortunately, just recently, all of the book, this is all of the book, it translated into English. It is recently translated, about a few years ago, by Lale Bakhtiar. Her name, American woman. And she published it, and she founded a specially publishing house for this book. It's called Ghazi Publishing House, which is located in Chicago. And she published this very important book because it contains not only this woman, William Osler. I think all of you know about William Osler. This is a Canadian doctor, and he was extremely interested in history of medicine, and he was one of the four people who is professor and the founding of Johns Hopkins Hospital. He is one of the four professors who founded Johns Hopkins Hospital. And this man, after he studied well the Kaadan book of Avicenna, he recognized and he said that it is the most famous medical textbook ever written, after it was translated into Latin. So this book, it means that very important. And not only this book, it was important. After 200 years after Avicenna, this man, he came, his name Ibn al-Nafis, again Ibn, Mac Nafis, he was born in Damascus and he died in Cairo. He tried to make a comment or to explain the anatomical part of the Kaadan book of Avicenna. Because Avicenna, he began his medical book by introduction in anatomy of human being. He took this anatomy section and he explained it in a big volume book. And he called it Explanation of Anatomy of Avicenna. In his book, actually, This man, he explained about pulmonary circulation 300 years before William Harvey. Nowadays, if you go back to all human physiological books, they talk about William Harvey is considered the British physician, considered the first who described in the 17th century pulmonary circulation. Now, half of physiological book talk about William Harvey as the discoverer. Other half talk that Ibn al-Nafis, Muslim scholar from Damascus, he described it 300 years before William Harvey. Fortunately, just recently, Journal of Applied Physiology, this is American journal, which is published by the American Physiological Society. Just 10 years ago, in 2008, they published very important article by this man John West, his name John West, as you can see here. He talked about Ibn al-Nafis, the pulmonary circulation and the Islamic Golden Age. And this paper, again, he stressed that Ibn al-Nafis, he talked about pulmonary circulation before William Harvey, 300 years. And some people believe that William Harvey took this information from Ibn al-Nafis' book. Because Ibn al-Nafis' book, it was translated into Latin. And we know that nowadays that William Harvey, he knows well Latin language. So we are not sure that if he, for example, read this book or by himself he discovered that. But at least we can say that Ibn al-Nafis, just like John, when he mentioned that, John West, he mentioned that Ibn al-Nafis, actually 300 years before William Harvey, he talked about what we called it pulmonary circulation. Last one I would like to mention, very important surgeon who was called the pioneer of surgery during the medieval age. Now this man, he was born in Arabic area. He was born in Al-Andalus, in Spain, under the rule of Muslim people at that time. He was born in Spain and he practiced surgery in Spain. And he left very important book related to surgery, which was translated by two British men, scholars, Spink and Lewis. These are the people under the title Al-Bukaysis, his name in English, Al-Bukaysis, in Arabic, Al-Zahrawi, on surgery and instrument. And this book, it was translated by Spink, as you can see here, Spink and Lewis. Both of them belong to Wellcome Institute for History of Medicine, which is located, I think some of you may know this institute in London, which is very big and the most maybe important institute worldwide interested in the field of history of medicine. They published this book in 1973 after they translated from Arabic into English. This book is very important because it contains the one page in Arabic in front of the one page in English. It's translation. And the most important thing in this book, that it was translated again into Latin. And European people, they knew this book via the translation of this book from Arabic into Latin. And actually, this is the first page or the cover of this book. And according to Encyclopedia Britannica, when they talk about this man, Al-Bukaysis, they considered that the concept or the teaching of surgery, which he put it by his book, it stood for nearly 500 years, actually, as the leading textbook on surgery in Europe. This book. And not only of that, this is the translation, because it is full of instrument. Al-Bukaysis, when he talk about, for example, any kind of disease, suppose that he talk about cataract disease, he described the operation of the cataract. At the same time, he put the instrument which used in this kind of operation. And it is full of drawings such as like this instrument, surgical instrument. This is again Latin translation. It's not Arabic, but it is translated from Arabic translation. Again, this is the Latin translation, which is full of actually drawing. And this man, whose name is Chauliac, he's a French surgeon. He published in a book in 1363 It's called Major Surgery. This book is represents the base on European surgery built on. And this book, he cited 200 times from Albuquerque's book. He mentioned to Albuquerque's name more than 200 times in this book, which is considered the most important book of surgery which built. At the end, I would like to conclude my first presentation by remind you a statement which was stated by very important scholars who said that medicine was absent till Hippocrates created it. Dead till Galen. The first one, Greek medicine. The second one, Roman doctor, physician. Revived it. Dispersed till Rhezius or Ar-Razi collected it. Deficient till Avicenna or Ibn Sina, who actually completed it. Thank you for your listening for the first part of my presentation. I think maybe if we can devote just a couple of minutes for if you have a question or comment or something like that after my next presentation. Yes, please. Now, next presentation is completely different now. It's about, unfortunately, the impact of the Syrian war on health facilities. As you know, I am from Syria. I worked as orthopedic surgeon when I left the country 4 years ago. I still in the country for 4 years after the war, because you know that the war, it started nowadays, it's 8 years, 1 month, 3 weeks from the beginning of this war. It began in March 2011 and still ongoing until nowadays. I spent 4 years in the 4 years of the war and still in Aleppo city in Syria, which was extremely dangerous to still there. I lost many of my very close friends who are doctors. One of them he kidnapped and he paid $500,000 until he was able to free the people, his relatives. They paid for the kidnappers until they freed him. I have many of my physicians, as I told you, they were killed. Some of them killed by the governmental troop, some of them by the opposition group. So it was extremely dangerous for doctors, for me, or for any doctor to still in Syria. And we'll see now, after this slide, how much the doctors who left the country. Now this is map, which is just recently, about 1 month ago, and represent nowadays the ongoing war in Syria. Very briefly, I can say, because since I arrived here, many of American people, please tell us what is going on in Syria. We don't trust too much media about this issue. We want from you to know about that. I presented many presentations here in this university to talk about this issue. Very briefly, I can say that it began continuation of what we call it Arab Spring. It means that the people, they demonstrate against the government. They want a kind of democracy. And the same thing happened in Syria. And it lasted for 6 months like this. Demonstration, but unfortunately the government troops used to kill the people during these demonstrations. And it was peaceful demonstrations. Until international interfered in the Syrian war, which nowadays it's not Syrian war. It's proxy war. Many of great powers involved in Syria land. And to war each other, to fight each other. You know that it is not a secret. America number 1, Russia number 2, Iran, and Turkey, and many other great powers actually also involved in the Syrian war. And nowadays the situation on the land, this area is occupied by the government. This area is occupied by Kurdish people who are greatly supported by America. And this area contains the oil of the oil region of oil in Syria. Syria produced before the war about 500,000 barrels every day. Nowadays, all of this oil is located in the area where occupied by Kurdish people, who are supported by America. And this place, also it's a kind of six people who are supported mainly by Turkey troops. Nowadays, the situation is extremely complex now, very complex, and it is not to be easy nowadays to be solved. Because, as I told you, many international powers, they involved in the Syrian war. And this is at least the current situation in the area. And you know that Syrian government extremely supported by Russia and Iran. Still, they supported by these two countries. And nowadays, we witness a kind of new development in the war. It is a kind of conflict between Russia and Iran. Because nowadays, there is a kind of contradict of the interest. While during the last year, they used to support the government, Syrian government, nowadays, everyone, they have a good share of the cake. And there is a kind of contradict between the interest between Iran and Russia. Nowadays, there is a kind of conflict, but is still under the table nowadays. We are talking about just recently what is going on nowadays. So, and according to the Center for Public Health and Human Rights of Johns Hopkins and Syrian American Medical Society, SAMS, they stress that Syria is the most dangerous place in the world to be a doctor. And I recognized that when I was there. Doctors extremely targeted for many reasons. Opposition, they want to arrest them to treat their patient. While the government, they don't want them to do that. And not only of that, the government passed a law in 2012 making illegal to render medical aid to anyone from the opposition. I have one of my colleagues who is a general surgeon. He provided such kind of services for injured soldier belong to the opposition, and he was under threatening of to die if not to do that. And he did that. After that, he was arrested by the government, and he was tortured for 20 days until he died. Under torturing. So the situation was extremely dangerous from both sides. And I know one of my colleagues as well, he was the chairman of the director of University Hospital, Aleppo University Hospital. One time there was demonstration near to the hospital, and an injured female, she was a student in the university, it was injured in her leg, and it was introduced to taken to the hospital. And actually the doctors around her, they sympathized with her. And they put her in intensive care unit. Because in this place, there is a guarantee no one from the intelligence will enter there. Intensive care unit. The next day, the director of the hospital, he made a round to see this girl in the intensive. He said, why she is here? And we have many patients, they are waiting for intensive care unit. And he discharged her to normal room, and then it was arrested by the intelligence. Because of that, after a week, this man, he was kidnapped by the opposition, and they killed him. So many actually unbelievable things happened during the Syrian war. I can talk from now until maybe tomorrow morning many stories about such stories, which is very bad stories about the war in Syria. But the most important thing we are surprised about, all of the international community is still silent. Nobody can do that. And you know that in Security Council, it was 7 decisions related to Syrian war to be issued, but it was aborted by Russian veto. And this is a kind of paralysis in our international law. Nobody can do anything because there is a kind of abortion of such decision. So, until the year of 2017, more than 2 years ago, 800 people only from the medical staff were killed. Doctors, nurses mainly, who were died, and the majority of them, they died by the government. Not only the government, actually, you know that 2 years ago, many of actually strikes against hospital, which was committed by Syrian force or by Russian flight as well. And many hospitals it was. This is about the number of those people who are belong to medical staff. The majority of them, they died because of the government forces. Yes. And not only of that, patients fear hospitals and other health facilities as they are a bombing risk. Many patients, half of the patients of Syria in Syrian ward, they afraid not to go to the hospitals because they believe that hospitals are targeted always by bombing it. And it happened. Many hospitals were bombed. Actually, this is just an example of one hospital for partially bombed, but this is a near corridor near to the operating room. This is inside the operating room. Actually, can't find that. So the people, they never trust more to go to the hospital because usually to be targeted during this war. And the problem is when there is a bombing or something like that, we don't have at that time an ambulance to transfer the patient. They used to use this kind of vehicles, which is, of course, there is no any characters of that which should be available to transfer the patient to the hospital. And then this is another types of vehicle which used to transfer the patient to hospitals. And emergency rooms, it was extremely crowded. Until the staff itself, it was not enough. And you can see many of the patients who accompany them, they used to help the medical staff in doing something because there is extreme lack of this staff. And as you can see, there is a waiting people. They wait just to see what is going on in front of his eye. This child, for example, which is unhumanitarian at all, to see what is going on just before him, and then he will to be emergency underwent to him or something like that. And this is the white Hamlet. Actually, they did very important job, but unfortunately, they accused by the government as they are spies. Spies? How you can say it? Spies? Yeah, sorry. It's okay. So this is another group of white Hamlet. And you remember that this boy, which was extracted after a few hours after his building completely destroyed, and he was extracted. And I remember that because this child, just to mention that, all over the world, none of children, they did that except a child from America. He sent a message to Mr. Obama at that time. Mr. Obama, he was the president at that time. And he sent him a message. Please, Mr. Obama, please give Omran, his name is Omran, give him a visa. I want to receive him. And I want to live with us in our house. We have 2 bedrooms. This is very important because we have extreme lack of surgical instrument fixation of the bone for fractures like plate, screws. And then the doctors, they found themselves going back to a few hundred years ago to practice medicine to make such kind of spica, total body spica of plaster of Paris to treat multiply fractures, not to do operation because they don't have the convenient instrument like plates, like screw, like nails, like something like that. So many kind of these treatment were done. And regarding external fixation, usually we have to put it in the patient limb for 3 to 6 months. Sometimes it was limited only for 1 month because we have it to sterilize it again and to put it for another patient. We have extremely lacking in such kind of instrument. And you can see here many people, this one who accompanied the patient himself, and he wear a glove, surgical glove, just to help this nurse, to help him in doing a kind of suturing the wounds. So you can imagine to how much extent it was extremely the same thing. This is the father of this child who helped the surgeon just to fix the patient for doing suturing of the wound. This is another example. And we have the problem of committed fracture. All of these comminuted fracture, open fracture, it was treated in the emergency room, not in the operating room, where it was contaminated. And this many times lead to infection, and this infection lead to complete amputation. Many people, they amputated, which is not required to be amputated, but because of severe infection, and there is a lacking of sterilization, lacking of antibiotics, something like that, so we have such kind of amputations. After a few years of the war, many of volunteers, they arrived to Syria. Not to Syria, inside Syria, maybe in the campus around Syria, refugees campus actually, such kind of tent hospital. This one, this is again the team, and these are also hospital. And one of the most important problem, actually it was infectious diseases. As I told you, because no sterilization in many operations, and you see here, sometimes they have a surgical glove. I still remember some surgery were done without gloves at all, because it was not available. And the team, they have to do something for the patient without. They did the kind of amputations, a kind of operation without surgical glove. And this consequently will be, for example, of course, the infection. It was widespread at that time. And you know that because of the lacking of vaccination, no more vaccination, because of the war, and then many of diseases spread again, include measles, typhoid, hepatitis, dysentery, tuberculosis, etc. And the most important is leishmaniasis. You know leishmaniasis? Leishmaniasis is a kind of infectious disease. We have two kinds of leishmaniasis. The most important then is called the skin leishmaniasis, and we have visceral leishmaniasis. Skin leishmaniasis was very famous in history. It's called Aleppo sore or Aleppo boil, because it was spread in Aleppo maybe a few thousand years ago. I still remember when I arrived America here for my first visit, it was 25 years ago, in a congress in Florida. I attended the conference, I saw the people like this, they are getting their lunch. And I sit down in one table and introduce myself to them. One of them, he said, "You are from Aleppo?" Because I introduced myself, I'm from Aleppo. Yes, I said, "Have you ever been there in Aleppo?" I was so happy to know that. He said, "No, but I know I'm a dermatologist. From our textbook, we have Aleppo boil." This Aleppo boil, before the war, it was nearly completely to be finished. Nearly. But after the war, actually this is leishmaniasis in Syria. It was widespread again. And it's the cause of this disease is, the sandy fly, or called phlebotomus. It's a kind of a fly, transfer the parasite and attack the discovered parts of the body, mostly the face and hands and foot, actually. And then this is just an example of that, and usually it should be treated by injection, the boil itself, by antimon. It's a kind of drug which is especially to treat leishmaniasis. So this is just an example of injection it, and you can see the mother herself also have the same disease. It's the same problem, because usually the phlebotomous flies usually come together and they to sit on the body and to inject them, the parasite, and then this kind of disease will develop. And you can see many patients, like for example this child, many of this, which was very rarely to be seen before the war. Sometimes you can see one boil, but not like this multiple boils, like this child, and you can see here it's making kind of deformities, and this is a mom with her actually child, the same thing, they have the same problem, and the most important thing is poliomyelitis. After it was completely Syria, one of the country which eradicated poliomyelitis 18 years before the war. 18 years before the war, WHO announced complete eradication of poliomyelitis from Syria. But unfortunately, in 2013, it was appeared again. And not only among Syrian people who are in the refugees. In Lebanon, in Jordan, you know that in Lebanon there is 1.5 million Syrian people, and all Lebanese people are 4 million. You can imagine about the fourth of the people of Lebanon nowadays Syrian. The same thing regarding Jordan, about 1.5, and in Turkey, about 3.5 million people. Syria, before the war, it was 29 million. Nowadays, only 15 million in the country. About 7 million, they left the country. And the people who are still in the country, half of them, they left their houses to another places which is believed more safe than their own places. So about more than half of the people of Syria either left the country or left their houses inside the country itself. So you can imagine how much is the problem in Syria nowadays. And this is vaccination which actually used to apply on the student under the control, on the children only under the control of the government, while in other remote places it was not. And this is why poliomyelitis, it was again to be appeared. And this is very important to know that the peak here, Syria, among the most country where in 2014 and 13, the most country where poliomyelitis is widespread than Afghanistan, than Iraq, than Nigeria, than Pakistan, Somalia, because of the war. And as I told you before the war, it is announced that completely eradicated. And in conclusion, I don't want to be more long, maybe less than 1 hour now. So in conclusion, can say that Syria is the most dangerous place in the world to be a doctor. And this is what made me to leave the country. I'm so happy to leave it because I know many of my colleagues nowadays, I'm in connection with them in Syria. They are suffering. Half of them are depressed. And it is estimated among 15,000 doctors in Syria, half of them, more than half of them, they left the country. The majority of them, they are living in Turkey without any job. Because until now, Turkey is not permitted for Syrian doctor to work. Because as in America, I'm not work as orthopedic surgeon. You know that, many of you, they will know that I work in the field of teaching at Webb State University. I'm a professor in the Webb State. But I'm so happy, no problem for me, as far as I feel that I do something. I can live. So no problem. I'm so lucky among my colleagues who, when I began to get my PhD in history of medicine, this is a funny thing. Many of my colleagues, they told me that you are a crazy man. What is the benefit of history of medicine after you have got your qualification as orthopedic surgeon? You will lose many of your customers, your patients. You lost money just to study PhD in history of medicine. I couldn't imagine at that time that this history of medicine, my doctorate, my PhD, will help me to come to America. Because I'm here not as orthopedic surgeon. I'm here because I have this PhD in history of medicine, and I began to teach history of medicine at Webb State University. And I used to call my colleague in Turkey. Many of them, they say to me now, we were crazy, not you, because you studied history of medicine. And now I recognize to how much extent it was beneficial for me to finish PhD in history of medicine. So I am here, unlike many of Syrian doctors who have no job at all and who are still in the country and they are still suffering from so many things actually. And then some hospitals were completely destroyed and the other not destroyed. There is many people, they have kind of to fear to go to the hospital because usually it is targeted. And formerly just rare infectious diseases have spread again in Syria, and mostly these diseases are affected children and mostly leishmaniasis, which deformed the body. And another thing, also poliomyelitis, it was again widespread after it was completely eradicated according to what announced by WHO. Thank you for your listening. Any question, please, or comment? Dr. Kort, maybe?
Just, I don't, maybe the microphone doesn't work. Just a quick question.
Yes.
You mentioned the white helmet and showed two pictures.
Yes.
Can you talk about the white helmets a little bit? Who they are, which side they're on, what they do?
Actually, white helmet, they are mainly from Syria. And they belong to some NGOs. And they were prepared and they get some help from some foreign countries like Britain, like America. They help them and they provide them with some equipment to help them to survey or to rescue some patient or some people. But they, at the same time, they were a witnesses when the government, they used chemical weapon. You remember that? It was used many times in Syria. And they were witnesses of that. And they were interviewed by some of European or American channels. What did you see? And they saw all the symptoms and signs of chemical weapon. For this, the government said that those people are liars. They are not real people. They are appointed by American intelligence, by European intelligence, and they pay them money just to fake a kind of a news, which is not reality. This is the beginning of them. And then after that, they got more help from some European countries, and they continued. And just recently, many of their places, it was taken again by the government. And they want, if the government, they will catch them, they will die. Sure, everyone he will say that. And then they moved to Jordan. And many countries, they discussed where they can go. And at the end of the day, they went to some European country and they stayed there. But they are originally Syrian people, belong to some NGOs, like, for example, Red Cross Society or something like that. Yeah. Okay, thank you so much. Thank you again.